I'm Ken Kelly, and I've got a real burning passion for counselling skills. I've built training that takes the doubt out of using counselling skills. You get to see the counselling skills used in real live sessions by a qualified therapist. Full sessions, real material, real counselling skills. To find out more, go to counsellingskillsacademy.com.
Welcome to the Counselling Tutor Podcast, the must-listen-to podcast for students of counselling and psychotherapy. Here are your hosts, Rory Lees-Oakes and Ken Kelly.
Hi, I'm Rory, and with me, as always, is Ken. How are you doing, Ken?
I'm well. Thank you for asking, Rory. Extremely grateful, both Rory and I, to be here. You've caught the Counselling Tutor Podcast at episode 231. We've got three exciting topics that we're going to be covering today, starting off with our Counselling Foundations, revisiting the important theories and concepts that underpin what we do as counsellors. And today, we're going to be looking at the 6 necessary and sufficient conditions for therapeutic change. Wow, one sentence. That trips me up. Therapeutic change. Then we're going to focus on self, where we're looking at appropriate self-disclosure. I think that's an important topic, something that comes up a lot. And then in Practice Matters today, a really phenomenal interview by a luminary in her field. Rory reached out, spoke to Dr. Mary Goss about working with couples. So that's what we have to look forward to. We're starting off with those foundations, the 6, Rory, necessary and sufficient conditions for therapeutic change. And I noticed, Rory, that you didn't say we're going to chat about the core conditions.
No, because we're not going to chat about the core conditions. We're going to talk about the 6 necessary and sufficient conditions for therapeutic change. And of course, what we're talking about is part of what I've named the Trinity of Rogers' theories. That it's 3 legs that hold the tabletop up. We've got, in 1951, he talked about the 19 propositions. In 1961, he talked about the 7 stages of process. And in 1957, not quite a halfway point, but, roughly halfway for the purpose of this discussion, he published the 6 necessary and sufficient conditions in the Journal of Consulting Psychology about 5 years after he'd stood on the podium at Chicago with Otto Rank, who was talking about will therapy. And it separated Rogers from the rest of the pack. In 61, he published his theory of personality, which laid a line in the sand and began the third force in psychology, which was, of course, humanism. And to back that up, his theory of personality was based in perception, the world of phenomenology. Then when he came to thinking about therapy, he published 6 conditions, not 3, 6 necessary and sufficient conditions. And just to remind us, Ken, of those conditions, the first one was psychological contact, that the client and the counsellor share what Fritz Perls would refer to as equal and present time. In other words, that they were both roughly in the same space of perception, and if we think about psychological contact, if you're dealing with someone who may be very seriously ill with psychosis, or maybe under the influence of medication or alcohol, you're not going to get that connection, and that psychological contact is important. Then he talks about client incongruence. Client needs to have something to bring. Client needs to have something to bring to therapy. And then we talk about really the first of the core conditions, which is client-counsellor congruent, very real, very present. For the client receives empathy from the counsellor. In other words, at some level, the client buys in and understands that person's trying to help. Number 5 is the counsellor shows unconditional positive regard. Is non-judgmental. And number 6, the client perceives and accepts the unconditional positive regard. And go on, Ken, ask me why do I call the core conditions?
Rory, so often when we're kind of thinking about these conditions, we say the core conditions. When was it, can you explain, please, pray tell, Rory, that Carl Rogers mentioned the term core conditions?
Well, he didn't. Carl Rogers didn't mention the core conditions at all. He mentioned the facilitative conditions, but he never mentioned the core conditions. That is down to someone called Robert Karkoff. And for those of you who are doing skills, you may know the Karkoff and Truax inventory, where you can map empathic and congruent responses. And Robert Karkoff was a social worker. And I think what we have to think about and remember is that at the time Rogers was developing this theory, majority of this type of work was carried out by social workers. Remember, he worked with Jesse Taft at the Rochester Children's Society. It was Taft who translated Otto Rank's work from the German into English, and in fact introduced Otto Rank to Rogers. And Karkoff was a social worker, and this is the bit that sends a shiver up my spine when I talk about this, Ken. Is that what Karkoff did is he took 3 conditions that could be used anywhere else other than therapy. He took empathy, congruence, and unconditional positive regard. It formed the basis of modern social work practice. It formed and permeated into education, certainly here in the UK. And the legacy of that is that if you look at any advert for, be it healthcare, personal care, anything in the social care, they'll always talk about client-centered or person-centered.
Yep.
And that really is down to Karkoff skimming those conditions off and thinking we can apply those to something else. Because, if you're a teacher, psychological contact, client incongruence, and client perceiving and accepting unconditional positive regard really it's really not in the remit of teaching or social work. So the impact, dropping that pebble into the pool, the ripples are massive, and they still resonate today, all the way through history from 1957. It's incredible.
It is incredible. It's incredible that those ripples, what they have created, and the change and the difference that has made. And I think that I'm so glad that we were able to focus in on core conditions versus 6 necessary and sufficient conditions. Rogers said there are 6 conditions. They are necessary. In other words, they have to be there for this psychological contact and for the process to play out. And he also says they are sufficient. That is all we need. Yeah. Those 6 necessary and sufficient, not 3. 3, we're working with half of them. And of course, they're powerful. Empathy, congruence, UPR. They are so powerful. But they only make sense when we look at all 6 of them together. So as you said, Rory, we talk about the facilitative conditions rather than core conditions, if we're speaking in the language of Rogers, facilitating the relationship. And of course, the other 3 are based within the client. So if we take them one by one and we talk about psychological contact between counsellor and client, you've already mentioned what that might look like, Rory, and what might impair that, such as being under the influence and the client not being able to fully engage in therapy. Well, that would break psychological contact. And if we look at Rogers' theory, he says if that is broken, then the rest of the relationship falls down. They are all necessary to be there. And they are sufficient if they're there. In all 6 of them are there. There's the word stumbling again, Rory. So yes. Another thing with psychological contact we might look at is if somebody is sent for counselling, they don't think they need counselling. They're going in and they sit down in front of you and you say, well, what is it you want to bring? And they go, well, nothing really. I've been told I need to come in here by my work, by, I don't know, my teacher, wherever you might be working. Then the question is there psychological contact? Is that client there for the reason of being present, being engaged in the relationship, or are they going to be standing slightly outside of the relationship with their arms crossed watching you work? You're not going to break through there because the person is not there's no connection. That psychological contact. I'm here for this process and I'm engaged in it with you. So there's that psychological contact. Then it speaks about the client is incongruent. Now, when we look at the facilitative conditions, we are told congruence is really important. And congruence, what is that? This is from the point of view of you, the therapist. Congruence is What you feel inside is shown outside. It is a transparency of you as a person within that relationship. You're not playing the part of a therapist. You're really being you in that human-to-human interaction. And you're being 100% truthful with what you say and how you act and your way of being within the relationship. So that's the congruent side of the facilitative condition. But within Rogers' theory, he says the client is incongruent. And of course the client is incongruent. What they're feeling inside is not what is represented outside, and that is what causes the pain, and that is what brings them to see you in the first place. They come in going, I'm feeling like this, but I shouldn't. In other words, they're inside, it feels like this, but I shouldn't feel like that. Therefore, there is incongruence. I'm feeling like this, and I don't know how to make that go away. It's affecting my life. There is an incongruence. So the person coming into therapy, if there was no incongruence, if they were completely accepting of who they are and how they are, they wouldn't be presenting in therapy in the first place. So they need to have that level of incongruence, Rory. Yes, go jump in.
You're absolutely right, Ken. You're absolutely right. And I think, and if you're a student listening to this, pens out. I'm going to drop a truth bombshell here. There's three client conditions, and they're congruence, empathy, and unconditional positive regard. Those are important to the client, but the other three conditions are actually, pens poised, they are for assessment, and it allows the therapist to make an ethical and realistic assessment of can therapy take place. If you have someone who isn't in psychological contact with you, then really you're not going to get very far. If the client hasn't got anything to bring, maybe, we think about coming to the end of therapy where people are just coming maybe sometimes for a chat and actually no work's being done, then there's no therapy taking place. And also, and I think this is the really important one, client perceives acceptance and unconditional positive regard from the counsellor. And that's about the relationship. And that is a great, when we think of assessment tools, we think of ticking boxes, 1, 2, 3, 4, 5, good, bad, excellent. But actually assessment here is phenomenological. It means the therapist has to make a call on, is the relationship functioning enough for the other conditions to work, or at least the core conditions. And if it can't, then obviously some reparative work or a conversation about, am I the right therapist for you? He covered all the bases, Rogers.
He did, and that you've just mentioned there, that's the final one that I wanted to dive into, and that is the client perceives acceptance and unconditional positive regard. So if we go to the facilitative conditions, we as the counsellor are using our way of being to show empathy, to try and understand it from the client's perspective. And we are working to be non-judgmental within that relationship, no matter where they are, what they've done. We're not judging that, we're just being with them. However, we look at the sixth necessary and sufficient condition, which says if the client doesn't perceive that from us, if it's not there, if they don't get it, then it is not effective therapy. So an example of ineffective unconditional positive regard and empathy is like this. If you're watching a film and that film has got a touching moment in it, you may feel a level of empathy. You may feel for the person, the character that is being portrayed in the film. So you are expressing empathy, you're feeling that emotion within, but the person in the film has no idea that you're feeling that empathy. They don't know because they're on a film. So within a client relationship, we feel the empathy. It comes up within us, and we're showing that unconditional positive regard. But unless we are expressing ourselves in such a way that the client goes, I'm being heard. This person gets me. This person understands me. This person accepts me for how I am, then we're not hitting that number 6. Client perceives acceptance and unconditional positive regard. It brings it together. Taking 3 of the conditions and standing them alone, I think it makes them lonely because they need to be with their 3 pairs. 3 pairs. What am I talking about? Pairs or twos? They need to be all 6. together.
Yeah, you're absolutely right, and I love the way you've outlined the sixth condition. And it may be that some people are listening to this and thinking, "Well, I've only been taught 3 conditions in my training," and I guess if you're doing UK certificate, which would be level 3 in England and level 4 or 5, I think, for our friends in Scotland. You would only be taught 3, and the reason is that a certificate in counselling skills can be used in a multitude of work. You could use it as a helper, you could use it as a support worker, and understanding those is really, really important. It's only when you go into actual counselling training that the other conditions are revealed. But I do think that there is an overemphasis on what's called the core conditions. And, I think that anybody who's training to be a therapist, or anybody is a therapist, have a look at those hidden conditions, those conditions that really are the therapist conditions, and sit and think about, how can I use those within the relationship? How can I develop a better understanding of them, or a more nuanced understanding? Because those are the things that bind the relationship. And we know from the research, it's the relationship that is one of the biggest factors of therapeutic change.
Wow. What a topic. I love this topic. I'm very passionate about it. If you'd like to delve a little bit deeper into this, if you want to have all the references to what Rory has shared with the historic development and where it all came from, then grab the handout. And the handout is free. It's one of Rory's super duper handouts. It's called The 6 Necessary and Sufficient Conditions, outlines what they are, the origins of the term, speaks a little bit about the core conditions and why they called that and where that came from, speaks a little bit about the hidden conditions that we've just discussed here today, and it's got some amazing references in there, so academically citable in assignments or just for general interest if you're already qualified. Where do you get it from? Well, you go to counsellingtutor.com. You click on our podcasts tab, which is right at the top of our website, and find episode 231. That's this episode. And right there on the page, you can download your free handout, 6 Necessary and Sufficient Conditions for Therapeutic Change. There you have it, Rory. That is our Counselling Foundations. Moving on now, we're going to go to our focus on self, where we recognize that you are the beating heart of your practice. We need to be okay to be able to be there in service of our clients. And an interesting topic, one I know, Rory, you're going to tell us you probably saw again and again in the Facebook group, and that is about appropriate self-disclosure as a therapist.
Yes, do I mention the Facebook group on the podcast? Of course I do, Ken. And if you're wondering what is this Facebook group that Rory's talking about, if you go to Facebook and type in Counselling Tutor, you will find our Facebook page. You click on it. It is a closed group, but our wonderful caring moderation team will let you in, and you can join the conversation with thousands of like-minded people in the world of counselling psychotherapy. Could be a student, could be a qualified colleague, could be a supervisor or a tutor, or you could be all 3, I think, all 4 in some cases. But come on in and join the conversation. And one of the things that comes up is appropriate self-disclosure. And I'm going to start off this by sharing with you what I thought was one of the greatest pieces of self-disclosure I've ever seen. And it actually was on a TV program called Cold Feet. And it was one of the characters had died, and one of the characters had gone to see a therapist. And the character who was upset was saying, everybody else seems to be getting on with their lives, and I feel really, really upset. And, I just can't get past it. And she was focusing more on other people moving on than actually on her own process. And the therapist said, it seems to me that you are more upset about other people moving on than actually what's actually going on for you. And there's a bit of a pause. And she said, yeah, but they're all booking holidays. And the therapist said, when my husband was given a diagnosis of terminal cancer, we decided together that when he died, after the funeral was over, I would go on holiday and scuba dive, and that's what I did. And I sat there and I thought, I bet a therapist wrote that. It was brilliant, and I mean, it obviously was a TV program, but it was so close to life, and I just loved how that self-disclosure showed two things. One, we all mourn in separate ways. And two, it's okay. It's okay to move on, move your life on. And I think that appropriate self-disclosure, is an important factor in the relationship of counselling. Yeah. And I think that, clients want to work with a real human being. And I think disclosing a little bit about yourself, if it's in service of the client, is appropriate and helpful.
I love how you've done that, and I love the dramatic pause that you put in there, Rory. If it's in service of the client. Now, when we're speaking, we're not speaking about self-disclosure. That's not what this topic is about. It's about appropriate self-disclosure. And putting the word appropriate in front of self-disclosure would indicate that there is also inappropriate self-disclosure as well. So when we disclose that from our own past, that we have been through, we're walking a line. And the question is always, is this in service of the client? Because it can be inappropriate if we are leading the client. If we're saying to the client, that's nothing. Let me tell you what I did. Let me tell you about my life. Oh, that's interesting that you said that. Now let me tell you about what happened to me. That is, of course, inappropriate. It's not useful at all to that client. Appropriate self-disclosure will have some positive impact on the client. And we can now look at maybe what would make it appropriate. So I'm going to start us off for a few points here, Rory. I'll kick the ball, and I'm going to say appropriate self-disclosure might be normalizing something that the client feels only they are experiencing this. They're the only person in the world. They are less than because they are feeling this in this situation. We might disclose and share that others also feel this way. I, as a therapist, might have felt this way, to normalize that it's okay to feel that way. There's one appropriate self-disclosure.
Yes, absolutely. And also, what I found in my practice is separating liking and loving somebody.
Oh, yes.
And, I can remember, a client saying to me, I'm really conflicted by my mother. I'm very conflicted about my mother, and I don't get on and and I might have found myself saying, well, you can, in terms of my relationship, you can love someone, but you might not like them. Yes. And I've said that many times, and people have said, oh yeah, I do love them, but I just don't like the behaviour. And I think that sometimes just popping that little example in is really useful. But I do take your point, Ken. You don't want to have the therapist saying, you think you've got problems? Listen to my problems. or a problems competition where, my problems, I've had the same thing, but I've had this as well. If it helps in appropriate self-disclosure, and I think it can be really useful, because sometimes clients may think that everybody thinks like them, that the world actually thinks just in one frame of reference. Yeah. And to give them a contrast, I think is very useful in the process of that therapeutic journey.
Yes, definitely, Rory. So there you go. You've now kicked the ball back to me again, so I'm going to come with another one. So we've looked at those two areas of appropriate, walking that line of what is appropriate. And I want to use an example of, if you as the therapist have been through an experience that the client starts talking about, where you see yourself, where you see your own journey in what the client is bringing in. They're coming in, they may be speaking about a presentation, and you go, oh, I've been through that in my own journey. How do we work appropriately then? Is it appropriate to share part of our journey, or do we key into the part of our journey that we have maybe had an experience and just use that as a base of empathy in working with the client? And of course, it depends on you, and it depends on your relationship with the client. It depends on the modality or model that you may be working to, your approach that you use in counseling. And I'm going to use two examples here. I worked in recovery services for some time when I was in placement, and there are different models for working with those that find themselves in active addiction. One is called a therapeutic model, and the other one is based on the 12-step principles. Therapeutic model would use a cognitive approach to look at the behaviors of the person and to explore how you could work differently. And a therapist working in a therapeutic community, as it's called in recovery, would not share their own journey if they themselves had maybe struggled with alcohol or drugs or gambling addiction or whatever it may be. It is considered inappropriate, and it doesn't matter, and it is of no service to the client, because you're sharing with the client cognitive ways that they can think differently, that they can challenge their behaviors. So there is one model. If we look at the 12-step approach within a rehabilitation setting, it is considered the norm that the therapist would share parts of their journey so that the client can recognize this person has been there and knows a way out, as it were. And there's a description that is used kind of in 12-step therapy that a person in addiction is stuck in a hole. And they're stuck in this hole and they try to get out. They want to get out. They don't want to be there anymore. And the more they dig and try and get out, the deeper the hole seems to go. And all the professionals in their life come to the top of the hole. Their family, they go, come on, we want you to get out. We're rooting for you to get out. The medical professionals stand at the top of the hole going, come on, throwing some ideas and tablets down into the hole. We want you to get out. But the person just can't get out of the hole. And then one day somebody comes along to the hole, Rory, and they jump in the hole. They jump in the hole with the person that's stuck in that hole of addiction. And the person stuck in the hole says, what are you doing jumping in this hole? I've been in this hole for 10 years and I can't get out of the hole. What are you mad? You're jumping in the hole. And the person in recovery who is sharing their journey will say to the person in the hole, it's okay. I was caught in a hole like this for 10 years too, and I know a way out, and I'm going to show you how to do it. We're going to do it together. And there is kind of a little bit of an example of appropriate for one modality, not appropriate for another modality. It depends how you're working and whether it's in service of your clients.
Absolutely. And I think, I mean, thank you for sharing that, because I think that's really, really important to make a call on your modality and how you work. But I also think, Ken, that there are times where appropriate self-disclosure can be a bit more global. So, as a male therapist, I've certainly worked with a lot of men. And, I think it's fair to say that as a huge generalization, please don't let us in the postbag, that men may struggle a little bit more than women with their emotions. Was that the sound of the mailbox going off?
Some men.
And,
we'll put it.
And I in some occasions, I've worked with male clients who say, I don't like to cry, and it's not manly to cry. They've been told the old silly story, big boys don't cry. And I've said, I cry. If I see a bit of a movie, I've shed a tear, a bit of music. If I see something touching, I find myself filling up. And, for those who've seen me, I'm quite a big fella, quite a big guy. And, I've had looks from clients like, really? You cry? And it's like, yeah, of course, that's okay. It's an emotion. It doesn't really pick on your gender. That's an emotion. And I think that's appropriate self-disclosure.
Oh, yes.
And very, very, very useful. I know some of my female colleagues may very well speak to female clients about issues that are experienced more by women than men. And that's appropriate self-disclosure. It speaks in service of the relationship. I don't think you can have a relationship without just a bit of self-disclosure. You don't want to be a mysterious therapist like Dr. Freud sitting there with his notepad, trying not to get involved with the client.
Unless that's your modality and that's what you trained in, which of course,
there
you go. But
yeah.
I mean, so much now, as we said in our previous topic, the therapeutic relationship, the relationships itself, is really, really important, if not the most important, some research seems to suggest, in terms of the positive outcome for a client. And the big word there is relationship. And there's two people in a relationship, but it's not it's some one person sitting, listening clinically and writing down. There is an integration within the relationship. We bring ourselves as therapists into the relationship. Appropriate disclosure is how much of ourselves we bring. And when we hold a little bit of ourselves back, because sometimes it's inappropriate to disclose something. Other times it's really appropriate to disclose. And it's idiosyncratic, again, what I mean by that is it depends on who that client is, how deep that relationship, how it feels in that moment. You know, if we look to person-centered approach, we're taught about immediacy. That's bringing part of yourself into that relationship pretty strongly. This is a great topic for conversation, and we don't have any answers. Don't quote us on anything we've said here, because this is just two colleagues having a discussion about appropriate disclosure. The importance is we're having the conversation, we're thinking about it, and that's what this podcast is about. It's about getting you to ask those questions, have that discussion with your peers. What would you do? Take it to supervision. Speak about disclosure within supervision. If you are finding yourself sharing some with the client, go to your supervisor and discuss that. Was it appropriate? Did it work? What did it do for that client? Did you feel afterwards that you wish you hadn't said that? Are you glad you said that because it gave progress for that client? And I think as long as we're examining our practice, examining what we do, asking the right questions, then we're just keeping our sharp focus on that benefits and is in service of our clients.
Oh, I want to do a round of applause at the end of that Ken. And you know, I think sometimes as therapists, we can overthink the counselling, you know, the whole counselling relationship. When you boil it down, it's two human beings sat in a room, two people, one in service of the other, trying to help the other find the way out. And, you know, if that means sharing a little bit about yourself, I remember many years ago, I'm blessed with a double barrel name, and some people perceive that as me being posh, which is interesting. And one of my clients said to me, "Can I ask you a personal question?" And I'm thinking, "Oh, okay." I said, "Yes, of course. It depends. You know, depends what you want to ask, but yeah." And she says, "Do you like opera?" And I said, "No, I'm not a big fan of opera." She said, "What kind of music do you like?" I said, "Well, I like Oasis, a bit of Motown, maybe anything with a drum beat." And she was stunned. She said, "Really?" And I said, "Yeah." Oh. And from that moment on, the relationship changed. She must have thought that, I don't know what she must have thought. I was a member of the royal family or something. And she just realised I was a normal guy. I like normal music, and, you know, I'm a proud son of Manchester. And that was it. The relationship shifted. And that was about appropriate self-disclosure. I just said, that's the kind of music I like. I didn't say anything more or less. So, yeah, I'd echo Ken's sentiments here. You know, talk about with your supervisors, if you're in training or your peer group, or, you know, with other therapists, and get a sense of how other therapists work with appropriate self-disclosure, because it's, you know, it's a seasoning in the therapeutic mix, I think.
Oh, yes, adding that flavour and the depth of flavour. Oh, I like it, the seasoning analogy there. I'm going to stay with cooking, in my head at least anyway. I'm a bit peckish at the moment as we make this podcast, Rory. I think a topic for a future podcast, potentially, when clients ask us questions, because you just shared there from your journey that a client asked you questions. And as long as the question is not things like, what should I do? What do you think I should do in this situation? Because then we would be inappropriate. Well, we would be taking power away from the client of finding their own way, I guess. Or, depending on your modality, maybe you would suggest a action or something that they might do, or some homework if you were doing CBT. But if they say to you, things like, do you like opera? I wonder if coming back with, "Oh, that's interesting. I hear you're asking me if I like opera," is a good answer. Or, "Where are you going on your holidays?" "Oh, I hear you're asking me where I'm going on my holidays." Is, you know, if we're being asked questions about ourselves, how much of that do we share as well? Is that appropriate disclosure? When does that become inappropriate? Another topic, of course, because we're coming to the end of Focus on Self today. But I like that you've opened the doorway to that, Rory. Let's close the doorway on that for now, as we come to the end of this topic, and put it down as a definite discuss again as we now move away from that focus on self, with recognition that you are the beating heart of your practice, into Practice Matters, where we dip our toe into what washes up in the day-to-day running of our practice. And this can be anything from the business or paperwork of running a practice through to presentations that we might have within our therapy room, or to CPD or special areas of interest that we may choose to train in. And today is one of those topics. Rory, you spoke with Dr. Mary Goss about working with couples, which of course is specialist training. We would need a postgraduate to go and train to work with couples. A lot of intricacies there. Can't say that word. It is
moving parts.
Moving parts. Thank you. Oh, I've definitely got my autistic head on me today. I'm tripping up over absolutely everything. I do apologize, but there you have it. So you met up with Dr. Mary Goss, who is a great friend of Counselling Tutor, and who has actually built a course with us, Rory.
She has, and I would say part of my work is to meet fellow professionals in the field of counselling and psychotherapy, and I always do get slightly giddy and slightly excited when I'm not going to meet with Mary.
Yeah,
because she's such a wealth of information and just such a wonderful person. And she's recorded a fantastic lecture on couples, working with couples, for the Counsellor CPD library. And I caught up with Mary to discuss what are the main differences between couples working and working with individuals. And this is what she had to say.
Practice Matters.
The National Counselling Society is proud to sponsor Practice Matters. National Counselling Society are really excited to have launched their Children and Young People Therapist Register for counsellors working with the younger age group. To find out more, visit nationalcounselingsociety.org. nationalcounselingsociety.org.
And we're joined by Mary Goss, who is a couples therapist and has done a fantastic lecture on couples therapy for the Counsellor CPD library. So, Mary, you're very welcome.
Good morning, Rory.
And, thinking about couples therapy, it is a progression maybe from those people who've trained. They're trained and they've worked with individuals and then they decide to work with couples. But would you say that getting some training in couples therapy is useful or even essential when considering this?
It's essential, Rory. It's essential. It's not a place that we can dip into and dabble with, because, there is a feeling out there among those who do work without training that it's really not much different to working with two individuals in the same room at the same time. And obviously that couldn't be further from the truth. So that worries me a lot.
What are the kind of things that may not be apparent if you're just seeing, as you said, two people in the same room?
Well, I suppose one of the things is that there's a lot more to do in terms of what's asked of the therapist. And again, modalities differ, and but people nevertheless are trained to work with one person. So one of the people I quoted in the lecture would be Charles O'Leary, who's and was deceased now, an American person with a very strong person-centered background, but who during his life's work as a marital family therapist, I should say, developed a way of working, even with person-centered work, to be a couple therapist. And I think what he says is that, as a couple therapist, we need to be a facilitator, a witness, and an educator. Now, that doesn't come naturally at one level to a lot of people who are trained individually when you're dealing with the relationship as your client. So, there's so many things, really. It's a very big question. It is very different. And I think Bill Doherty, again, who's somebody with very strong feelings and very strong opinions on this. I won't spoil anybody's fun if they're going to watch the lecture, but he makes a really good analogy to the medical profession there in terms of a broken leg, but I won't say more about that just now. Anyway, if you go in as an untrained person to work with two people, you will find yourself making considerable mistakes. Whether you're a beginner who's just qualified or whether you're a long-term experienced therapist used to working with one person at a time, you will make massive mistakes. This is for sure. Of course, the thing is you won't know you're making mistakes.
That's the key thing, isn't it? That unconscious incompetence that we've spoken recently on a podcast about.
Absolutely.
That you won't know you're making mistakes. Now, you mentioned, a person-centered approach, but would it be fair to say that there may be a little more, shall I use the word activeness on the part of the therapist in couples therapy? There may be more things for the therapist to do.
Far more things to do, Rory. There has to be structure. There has to be a clear awareness of the context these people are in. So, a beginner most certainly will lack structure. And if you lack structure, then the couple will talk over one another, they'll talk at one another, and they may well lose, to a certain extent, lose control of how they're talking to one another. So with no structure in place, that will happen to any therapist who's not familiar with how to handle things. You've got to be active, you've got to get in there. And I think two of the things I can recall from the man I mentioned earlier, Charles O'Leary, would be, slow it down. And on top of that, then be a world-class interrupter.
Yes.
So you have to be a world-class interrupter. Now, many counsellors, whatever their way of working, will not naturally come in and interrupt and stop and pause and tell people to hold it and wait and take turns or whatever has to be done. But interventions, and there are dozens, there's hundreds of ways to work intervention-wise with couples, but we need to have, I suppose, maybe a fully competent and ready to become really good couple counsellor or therapist will have studied several approaches.
Yes, and I think that there is a danger, having spoken to you before about this at quite depth, I guess there is a danger that without that kind of structure, it could just get into an argument and a they said, he said, she said type of finger pointing, and the therapist may end up as a form of referee.
They will, and many therapists will then give up on the situation because, well, they're overwhelmed for a start, and on top of that, they reckon that one of them is more challenging than the other and probably needs individual work to sort it out, when there's absolutely no need for individual work. It's a rare thing to need individual work in couples therapy once you've started with a couple. Once you've done your assessment, the assess, and then assess is probably the way to start. So you could be on your third time with them before you're actually even thinking about counselling as such, So once the assessment aspects, the big assessment aspects are out of the way, and you're actually beginning to do some work, and you've decided it's safe to work with them together and appropriate, then I can think of very few ways or very few reasons why I would then separate them and work with them individually.
Sure. Yeah. I think that's really interesting, because you may get one person who's more dominant in the relationship, and it might lead the therapist to think that they're the person who needs the individual counselling. But there are times, aren't there, when we've spoken before, when you do an assessment, that you might think, it might be useful that I see one of the people, or one of the people is seen individually. What are those circumstances, Mary?
I think it's really around what we would call, in the world I live in, we would call it unsafe behaviour. And that's the only reason I can think of to have them separated for assessment purposes. If under those circumstances it becomes clear from a very thorough assessment of behaviours that there is abuse, domestic abuse of some sort, and that in itself is a whole a whole big area for discussion. But of the many categories of domestic abuse, if they are in a situation where coercive control is a feature, then you would not be seeing them together moving forward. If they have a variety of unsafe behaviours coming from the situational abuse category, if you like, then yes, of course, you can see them together. But you would have, I suppose, you would have in place a very sort of detailed safe behaviour agreement with them, where it's part of the contract that they will quickly learn how to manage themselves. So that's the education piece. I mean, the psychoeducation pieces are significant, and the amount of, it's really excellent now that there's so much autonomic nervous system literature and YouTube material out there, and Dan Siegel's hand-brain model and all the things that are there, so accessible for couples who can go off and check on things if they truly want to change quickly their understanding, and then gradually their immediate responses, then they can do that, and they do that quite quickly, and they become aware. So they give themselves time to relax into normality again before continuing arguments, and that makes a massive difference to the atmosphere in family homes. And the vast majority of couples coming for therapy have children under 18, so that makes a huge difference very, very quickly.
Yes, and I think you bring up very nicely into my next point, safety. Couples sometimes have children, and what are the considerations in terms of safety, protection of children that a couples therapist may have to think about?
Well, I suppose that some couples coming in for assessment will say up front, yes, the children have heard us shout at one another, they've seen us push one another around, they openly sort of recognise that, and maybe why they've come. Other couples say, oh no, we never argue until they're asleep, or they don't know we have arguments. And I would say, I doubt that very much. Children's radar is very well tuned, and they know very well what's happening. Other couples say, we never argue, but we haven't spoken for the last 3 months. And you're thinking, well, that's horrendous from a child's point of view. So whatever it is, whether it's silence or whether it's loud and inappropriate things being said, and even physical things being done, every child deserves to have a comfortable, safe and secure place to develop. And it impacts physically, physiologically, it impacts child development, obviously. So it's our number one concern that we identify. And if it is the type of situation where it's not coercive control, which the bulk of our cases coming for couples work are not coercive control type of domestic abuse or domestic misbehavior, let's say, then they can deal with that. We can support them in dealing with that. And big changes can happen quite quickly, which is very hopeful. Unless, of course, you've got addiction mixed in with it, in which case then the context becomes more and more complicated.
Yes, and I guess with addiction, that would be a different form of assessment and maybe a different form of contract.
Yes, it would. And some people come in with what any therapist would recognise as addictive behaviours that are at the edge of needing some sort of professional support, and no different for the couple therapist. The difference probably in the last number of years is that we would now, I believe, as couple therapists, we would insist on they go off and they get their situation examined, GP, medical situation looked at, some support in place, and then we would take them back as a couple fairly quickly. In the past, it used to be, they need to be clean for, or, free from, for a long period of time. And that's, there's a lot of research that shows that that's not necessary, that the recovery process is greatly enhanced for both people by being in the couple relationship, in couple therapy. So there's a lot of good research on that, and it points in that direction. So yeah, that's a slightly different maybe journey for the therapist as well as the people concerned. But yes, much more assessment needed for those specifics to make sure we're not assuming things will be fine and we will perform miracles. We will not perform miracles until the person with the relationship, whose main relationship is with their substance or their behavior, and they're never going to be able to work on a relationship with their partner. It's just very like infidelity in some ways.
Yes, I mean, I think that's really clear. We're seeing what's unfolding for me anyway. Listening to you speak, is that it's as equally as technical as it is therapeutic to be a couples therapist. The final question I want to ask you is the diversity element, working with people who are maybe different to you. What does a couples therapist have to consider when working maybe with people in the LGBTQ plus community, or people working with people who may be from a different kind of societal structure than their own?
I suppose the techniques wouldn't differ so much, Rory. There's a need for a lot of knowledge and personal examination of our own issues around everything we do, and especially when there are issues that would be as likely to be divisive for therapists as some of those that you've mentioned. We definitely need knowledge, and there's great material there for the two areas you've mentioned. Lots of really good material and really good sources of other people doing specific training in those areas, which are really, really helpful. I think fundamentally the number one thing for me is don't assume their problem has to do with their diversity. It might be ordinary couple things that have happened, but on top of that, we need to be very alert for the things that are specific to those populations, and that we know a lot about that, and we can recognize what we need to recognize and to bring up issues that they might not bring up themselves, just to check out whether that's part of their story.
Yes, and I like the idea of not attributing difficulties to difference. It's something that I used to teach quite extensively when I used to lecture. The lecture is very, very comprehensive. What do you hope people will take away from watching your lecture, Mary?
Well, if you are somebody who has tried to do some couples work without maybe the foundations to support you to do the best work you can, I would love to think people would say, okay, I can see now I do need to do something about this, and I need to get myself some solid, comprehensive, well-managed training and start enjoying couples work, because it is the most rewarding. It is probably the hardest form of therapy, according to some experts, but it is the most rewarding in terms of job satisfaction. It's excellent. I love it. It's very, very challenging and very complex, but the benefits are instant to the children, and that's what keeps me moving along.
Well, on those hopeful and may I say wise words, Dr. Mary Goss, thank you so much for joining us.
Massive thank you to Dr. Mary Goss, and of course to you, Rory. I mean, you host them beautifully, these interviews. You really do. You really extract the meaningful, useful information. I'm very grateful for that. And of course, if you're interested in what you've heard, interested in couples therapy, interested in hearing more from Dr. Mary Goss, Mary did make an incredible lecture, which is now live in the Counsellor CPD library. If you're a member of that, log in and go and watch that lecture. It is outstanding. If you're not a member of the Counsellor CPD library and you're wondering how you can get access to that, it's so simple. Just go to counsellingtutor.com, right there on the homepage, all the information you need to join up. And of course, this has been the Counselling Tutor Podcast, episode 231.
And we started off with the 6 necessary and sufficient conditions for therapeutic change, the 1957 Journal of Consulting Psychology, and Rogers talking about building, sustaining, maintaining therapeutic relationship. We moved on to focus on self and appropriate self-disclosure. What parts of yourself do you share with clients? And then we moved on to practice matters with Dr. Mary Goss, who talked about the intricacies and the mechanisms of working with couples. And as always, stay grounded and stay safe.
If you're a qualified counsellor or psychotherapist, then why not check out the Counselor CPD library? Stay current with your CPD requirements with over 150 hours of academically rigorous, on-demand lectures you can stream to your device. Joining Counsellor CPD will expand your skill set to create a more specialised, highly rewarding practice. For more information on the Counselor CPD library, visit counsellingtutor.com.
Thank you for listening to the Counselling Tutor Podcast. Find the show notes for this episode on our website at www.counsellingtutor.com.